afternoon, I will be talking about one-time low dose, that is 1% betadine wash to hasten recovery in viral conjunctivitis. I have been nothing short of amazed when I use this treatment, says Dr. Ernie Bolling. But this comes with a word of caution. Because a topical anesthetic must be used, it should be an office procedure only. Nearly 7 lakh patients present to the eye department every year with viral conjunctivitis, out of which 92% are attributed to adenovirus. It lasts for usually 1 to 2 weeks, follows a self-limiting course, and is highly infectious. The common complications are the pseudomembrane formation and chronic nummular conjunctivitis along with SPKs. It presents as photophobia, blurred vision, eyelid swelling, ocular irritation, and chemosis. Focusing the spotlight on the star of my presentation, that is povidone iodine. It has a broad spectrum of action, high microbial kill rate. It has action against wide range of microorganisms, reduces the microbial load on the ocular surface, and used as the off-label management of adenovirus conjunctivitis. So far, there is no FDA-approved treatment for viral conjunctivitis. So our study dates back to 2023 in the month of July and August, where there was an epidemic of conjunctivitis in North India. We got about 100 to 150 patients each OPD for 2 consecutive weeks. We screened 1,506 patients and 1,328 were included in the study. The inclusion criteria was patients presenting on day 1 and day 2 of conjunctivitis and without any ocular comorbidities. Every patient underwent a swab which was subjected to gram stain and culture. Automated identification and susceptibility was done by Vitek 2. Virological diagnosis was done by BioFire multiplex film array. So the result was that it was an adenoviral and an enterovirus co-infection. We divided the patients into 2 groups, 664 patients in each group. Group A received 1% betadine wash along with artificial tears, whereas Group B only received artificial tears airdrops. Pseudomembrane if seen was removed. Follow-up was done on day 3, 5, 7, 10, and 14. We followed the no-touch technique, where the patients were administered betadine, diluted betadine, serially in the OPD. They were handed over a tissue paper to dab off the excess of spillage, and they disposed of the tissue paper in the biomedical waste management bin. They sanitized their hands, collected the medication, and left the OPD. The outcome measures were in terms of signs and symptoms. Signs such as eyelid swelling, discharge, chemosis, conjunctival congestion, and symptoms such as blurred vision, eye itching, tearing, photophobia, and foreign body sensation. The results were as follows. Group A patients, nearly 73% of them showed remarkable recovery by day 3, whereas Group B patients, 1/3 improved by day 7, 1/3 by day 10, and the other 1/3 by day 14. There was no sequelae seen in Group A patients, whereas Group B patients manifested subconjunctival hemorrhages, 8% showed SPKs, and 36% patients had burning and dry eye symptoms. So you can see the remarkable difference of day 1 and day 3 picture of Group A patients, and the complications in the Group B patients who had subconjunctival hemorrhage and SPKs. So to conclude, one-time 1% betadine wash is relatively safe and reasonably tolerable. It is in fact better tolerated and non-inferior to 5% betadine, and it reduces the severity and longevity of symptoms of viral conjunctivitis. These are the related references, but however, all these studies have tested the use of 5% betadine. 5% betadine has to be washed after administration. We didn't have to wash the 1% betadine. The merits of our study is that we have, the sample size is really big. All the studies that were conducted so far, the sample size was very small, 15 patients, 20 patients, 256 patients, and that was the limitation of their study, according to them. The limitation of our study is that we could have done a viral load serially by PCR to check the actual reduction of the viral load. So with the beautiful eyes of Ma Durga and paying tribute to AIOS Kolkata, I end my presentation. Thank you.
Yeah, thank you, Dr. Sumedha. So betadine, actually, you are rightly saying it's an off-label use, and in fact, I have also used it on my patients, but I don't have any study to support it. Yeah, so you prepared that 1% eye drop in
Yes,
lubricating.
ma'am. We use
Yeah,
the 10% solution, 1 ml of 10%, diluted it with 10 ml of normal saline and administered
yeah.
it.
And on what days?
So it was
It's
one time
one
on
time use only.
day one
Okay.
and day two. And why we included the patient on day one and day two is because betadine is known to be the most effective in the extracellular phase of the viral conjunctivitis, where it inactivates the virus. And povidone iodine is the only known antimicrobial that inactivates the adenovirus within 1 minute of contact.
Okay.
It also gets better on dilution. The antimicrobial activity of povidone iodine gets better on dilution.
Okay.
And the other study that we are doing is we are also checking the efficacy of 0.1% betadine to support that, and we are getting comparable results so far.
Okay. Right. So thank you, Dr.